How I would approach figuring out the action of a new muscle. First, you can look at the striations of the muscle and figure out which direction they're going, because this often shows which way the muscle moves when it flexes. You can also look at the attachment points, the medial, superior, or lateral and inferior attachment points, and they show which bones and joints move towards each other. You can also look at the joints that the muscles cross, the two joints, because often the type of joint indicates the type of movement being performed. And you can also sometimes look at the name of the muscle and it'll show its function. So for example, this is the biceps muscle I drew, and as you can see, the striations of the muscle are horizontal, going horizontal to the humerus bone right here. And this shows that when the muscle flexes, the muscle fibers will be getting smaller and it will kind of bulge. And this kind of goes along with the attachment points, the medial / proximal attachment point, the supraglenoid tubercle and the coronoid process of the scapula up here, and then the lateral / distal attachment point, the radial tuberosity on the radius bone right here. This shows that when the muscle is flexed, the radial bone will contract towards the shoulder joint and the scapula. As these muscles get shorter, the two attachment points will move closer to each other. You can also look at the joints. The elbow joint is made up of a hinge joint, so it rotates 180 degrees, which goes along with the rotation of the elbow this way. And then the shoulder joint is a ball and socket type of joint, so it almost allows for full 180 degree rotation in two directions, but it also goes along perfectly with the flexion of the biceps muscle and the striations. There are 4 muscles that make up the rotator cuff. There is the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. All 4 of these have similar and different attachment points. For example, the attachment point for the medial attachment point for the supraspinatus is the supraspinous fossa of the scapula up here, and the lateral attachment is the greater tubercle of the humerus down here. As you can see, the striations of this muscle run horizontally, attaching the 2 attachment points. The infraspinatus muscle is the second muscle of the rotator cuff, and its medial attachment point is the infraspinatus fossa of the scapula here on the outside. And then it laterally attaches to the same point, the greater tubercle of the humerus. This also has almost horizontal striations showing how the muscle will contract and act if the muscle is flexed. The third muscle of the rotator cuff is the teres minor. This is under the infraspinatus, and it's also at the bottom of the scapular bone. Its medial attachment point is the lateral border of the scapula here, and it laterally attaches to the greater tubercle of the humerus up here. Medial, lateral. The final muscle of the rotator cuff is the subscapularis. And this muscle is different from the others because it is on the anterior side or front side. This muscle's medial attachment point is the subscapular fossa here, and it laterally attaches to the lesser tubercle of the humerus on the other side of the humerus here. As you can see, it also has horizontal and almost vertical striations of the muscle fibers, which correspond to the movement of this muscle when it is flexed. The striations of each one of the 4 rotator cuff muscles correspond to the movement of the attachment joints. For example, these striations are horizontal, so this will move closer to that. This is diagonal almost, so this will move closer to that. And then for the teres minor, it's almost the same thing. And then for the subscapularis, it's on the front, so it will also move these two closer to each other. The first muscle of the rotator cuff is the supraspinatus, and this abducts the arm in a motion like this. This moves the greater tubercle of the humerus, which is the lateral attachment point, to the supraspinous fossa of the scapula, which is the medial attachment point. The second muscle of the rotator cuff is the intraspinatus. It laterally rotates your arm, moving the humerus away from the body, like this. It brings the greater tubercle of the humerus closer to the infraspinatus fossa of the scapula. The third muscle of the rotator cuff is the teres minor. This has a similar action to the second muscle, the infraspinatus. It also laterally rotates the arm that way, moving the greater tubercle of the humerus closer to the lateral border of the scapula. And the fourth and final muscle of the rotator cuff is the subscapularis. This muscle medially rotates the arm like this, moving the lesser tubercle of the humerus towards the medial subscapular fossa.